Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So they're back, ladies and gentlemen, Randall Cooper and Mick Hughes. And on this episode, we're talking about why does exercise matter? We're going to talk about the new podcast that Mick and Randall have called Exercise Matters, and some top tips from their time running and convening all of the quality education that's out there on Learn.Physio. So if you want to hear a bit about Mick and Randall's background, there's a previous episode featuring Mick, Randall, Susanna, and myself, where we go into their backstory and sort of what led to this point in time, the setting up of the Learn.Physio platform and everything that these guys are doing. But I want to talk about exercise today. And in particular, I've got some questions that I think you'll find interesting. I'm interested in where these guys think physio fits in the patient care journey and how we can work alongside other health professionals and exercise physiologists, S&C, for example, and what they think our point of difference is within these teams and the strengths we should be doubling down on and standing our ground on, and the things the areas where we should be referring and working with other professionals. So it's going to be an interesting conversation. Let's get on with it. Mick Hughes, Randall Cooper, welcome back to Physio Foundations.
Luke, thank you. Thanks for the invitation to come back. It's nice to see you again and, talk shop.
Hi, Luke. It's great to be back. Thanks for having us on.
So let's talk about Exercise Matters. So your new podcast, how's it going? You're, 2 or 3 episodes in?
Yeah, we recorded 2 more this morning, so I think we're now up to 5 recorded. We're about to release we release one every Wednesday. So a third one will be out for us on Spotify and iTunes this coming Wednesday. So it's growing. It's really nice. Our latest count, we've got 150 followers on Spotify, which, you got to start somewhere. We're looking to amass the likes of Joe Rogan and
of course,
I don't know, Stephen Bartlett, the CEO kind of guy, if that's his name. I can't recall off the top of my head. But yeah, look, that's, in jest, we certainly probably won't ever reach those lofty goals, but it's just nice to sort of, create something and talk about something we're both passionate about. It's not only simply about exercise. Like our first topic was about recovery and evidence-backed recovery strategies. We talk about, like it's titled Exercise Matters, but it's that play on words and, it's not that it matters, it does, but also to the matters of exercise and components of exercise and, what helps us sort of do our physical activity and our sporting pursuits in a better way to keep us fit and active for life. So yeah, it's been a great start. Have you got anything extra special to throw that way, Randall?
Oh, I think going back to the start of why we decided to do it, like Mick and I were very keen to kind of get a little bit more from behind the paywall into kind of just the public domain a little bit more. And we also wanted to make sure that we had some content there that was very useful to health practitioners, but also the public as well. And exercise being such a cornerstone of the way physical therapists and physiotherapists treat these days, we also thought that it had broader application to kind of the wider community, so we could draw an audience there. I think that probably one of the most important things for us, though, was that in a physiotherapist's kind of practice, I think it's very important that practitioners understand what people are going back to. I mean, we get very good at kind of dealing with the injury and whether they come in with an ACL or a hamstring or a lower back concern. We're very good, I think, at that first kind of quarter to kind of half the treatment when it comes to exercise prescription. But if that person then wants to go back and play golf or tennis or CrossFit or swim, those type of things, I think it's really important to kind of have an understanding of what that entails. And also the difference between kind of like what an elite athlete would need to go back to versus someone who's very amateur as well. And if we can kind of help shed a little bit of light on the exercise that people do generally, the issues that are involved, and the pathway for practitioners to get that person back to doing what they need to do, then for both Mick and I think that, the podcast will achieve its aim.
It's a good name in that it's not physio specific, like you mentioned. You can reach out in broad areas throughout physiotherapy, allied health, medicine, wider community, sports, recovery, rehab. So that you won't run out of topic ideas as you get to the second year of it. Hang on a second, I've done this before. You won't run out of guests and topic ideas.
5 episodes in, we've also come to also use like some pretty user-friendly language too. Like there are times where I just need to rein it in and just make sure we're just talking to a wider audience, not just sort of focusing on the health professionals out there and the physios in particular. So I think we're learning as we're going, but that's what I really enjoy about this topic is really sort of keeping it at a high level information being shared, but done in a really user-friendly way. So it's been fun.
Yeah. So what do you think are some of the areas that are misunderstood or perhaps underemphasized about exercise in clinical care and in rehabilitation? Some myths perhaps and some problems you're trying to solve with your podcast.
Do you want to go, Mick, or do you want me to go for this one?
Yeah, you lead off, mate. You're a bit more experienced, got a bit more sort of years in the bank than me.
I think that one of the, this is a wider conversation than just exercise, but I think also, like when so many people get their information these days in short form content, so they're watching things on Instagram and TikTok, and even if it's like health professionals, like Mick and I, who are giving bite-sized pieces of information in those forums, I think that you can get a very polarized kind of view of exercise. And, if you're into muscle building or whatever it might be, and you show interest in 3 or 4 of those videos, then you're just going to get a feed full of muscle building. And you think that exercise just kind of completely revolves around that. And then conversely, like if you're into Pilates or whatever it might be, that's what you get to. And I think the same extends kind of in rehab. So I think that one of the pitfalls I think at the moment, and it's a slightly different answer to your question, Luke, but I think that it's very important for practitioners to have a wide breadth of their understanding of exercise. I really feel that, people who are in rehab, just extending on my point before, need to be the jack of all trades. And that the misconception or the issue I see kind of with a lot of therapists is that they understand basic exercise, but they don't understand advanced exercise, advanced strengthening, advanced plyometrics, advanced balance exercises for 65-year-old, people, etc. So if that is something that the podcast or we can help with to broaden the understanding of exercise for health practitioners, then I think that's a good thing.
And in your entry to practice physio training, for example, we're physios, we're talking about that, but you could apply to other exercise-based professions or other professions who use exercise. You'll only ever get the basic understanding of anything at the end of your degree. It's the way it is. I've asked many, many students, do you guys want more content in your degree? Do you want to know more, or do you think you've had enough? And they always laugh and say, yeah, I think we're full by the end of it. So it's when you get to those post-grad years, then you need to get the advanced knowledge. So your platform fills that gap somewhat. How else do you get to that advanced stage of knowledge of exercise and awareness of how to apply it to different people?
Well, from my perspective, I think I've just probably got better with age and experience, and nothing can. Not that I'm 45. I've been a physio now for 15 years and an exercise physiologist for 5 to 10 years before that, and obviously I've got a bias towards exercise with my personal training and exercise physiology degree before starting physio. But I think where I've probably evolved as a clinician is just being older within myself, having those years of practicing, knowing what people can do, what they can handle, seeing like the weakest of the weak and the most deconditioned people coming back from really lengthy rehabs, and obviously then dealing with the strongest of the strong and the fittest of the fit. So nothing can really sort of prepare you for managing those type of people or that breadth of person other than getting some skin in the game and actually, treating patients and dealing with those extreme levels of deconditioning and fitness and exercise. So, and I think for me also too, becoming a busy parent also too has allowed me to probably just get a deeper understanding of exercise and how we kind of need to almost like work exercise around our lifestyles and pick and choose those moments when to do the work needed to live an enjoyable life. So, unless, I think experiencing parenthood and busyness firsthand also too makes you kind of, I think, a better clinician to prescribe exercise and find ways to bring exercise into people's daily lives.
That's a really good point. On the last episode we did together, Randall, I remember you said experience counts for a lot when we were talking about a similar question. And then how do you get that experience? And so as you're going through those phases of your life, you're picking up life experience that you can apply to other people. Mick, one thing you reminded us of is your first 10 years of clinical work were as an exercise phys and then a physio for the last 15 years. So maybe we could lead off with the next question, which is, what do you think our point of difference is as physiotherapists in prescribing exercise or using exercise in management of health conditions? You can directly compare to your previous work, working in both professions, but in general, what do you think? What's our point of difference?
I think the point of difference is clearly just being able to prescribe exercise in the presence of pathology really well. Not to say exercise physiologists can't, but I think we've sort of just with our levels of training, knowing and understanding different pathologies and how they interact on what a person can and can't. Like I always use the knee as an example, like the ACL injured knee after an ACL injury, and this is obviously just one example of many others we could pick from around the body, but the ACL injured knee, it's so load intolerant, it's not funny. And then whack a surgical procedure on top of that. We're kind of got two big traumas and a lot of stress, inflammatory stress, and a lot of muscle inhibition, all those kind of things that impact on the person's ability to tolerate load. And that's where I think a good experienced physio can certainly, manage that stuff really, really well. And that's probably in our, strong skill set. Conversely, for exercise physiologists, they probably across the board will outdo us and outperform us as the middle and late stages sort of tick along. But definitely from those early stages of injury and dealing with acute trauma and managing those early sort of pathophys kind of things that we're really good at. I think that's probably the big differentiation from a musculoskeletal point of view. Obviously, cardio physio, cardio EPs and neurophysios, and we're talking about different things. But if we're just using the context of musculoskeletal practice, that's probably where I think we have got a great skill set.
Yeah, there's obviously a lot of learning that happens throughout your career. It's not just at the point of graduating and the skills that you've got. So what do you think, Randall? What do you think our point of difference is?
Oh, I love Mick's answer, and I think that he's spot on. The thing that I'd add to that is that, by the way that physiotherapists generally work is that we see a high volume of patients. So with acute pathologies. So the exercise phys, a lot of them will have more longer term patients. They'll spend longer time with them, for an hour or whatever most of the time. So physios get a breadth of experience and a deeper both training understanding and also a practical and experience understanding of pathology. So I think that it holds us in very good stead to manage new injuries, acute injuries, post-surgery, particularly in the early phases. And I think that, we as physiotherapists should have the training and the understanding to kind of take someone all the way through to where they want to be. But on our point earlier, that won't get trained in undergraduate physio. That's something that you'll need to specialise in and become quite narrow in that application. So for me, for instance, I was I'm a specialist sports and exercise physio, but if someone comes to me with a wrist or an elbow injury these days, it's like, I don't know what I'm doing. Like, just I'll give it to somebody else. But if it's a knee or a lower limb injury and they need to kind of get back out and ski, or play AFL football, where I've had essentially decades of experience, and I feel very confident that I can kind of take them all the way through there if that's what they want also. So I double down with Mick.
So it's that confidence of knowing what you know and what you don't know, and the networking to know people to refer to, for example. That you make a good point about you have to start broad in your career. You learn a whole lot of stuff about a whole lot of things, a little bit about everything. And then if you want to take someone to the advanced stage and work with or even compete with, say, an exercise physiologist or a strength and conditioning professional, you've got work to do to develop yourself in that area, like you did, Randall. So,
and it never stops, Luke. Because I reflect on my own career, for instance, and I had essentially kind of a specialty in knees, but I also had specialty in sports as well, being skiing and football to a lesser extent. But because I was kind of known as the knee guy, I would get patients in who were jockeys or circus acrobats, or, I can keep going with all these bizarre kind of, athletic endeavors. And at that point, that's where you go, well, who else can help here? Like am I the person who can help them all the way through, or do I need to kind of reach out to the specialist in circus acrobats? And of course I did both. So I would always use that, even as a very senior physio, I would use that as a learning experience. What does getting on the totem board involve? And when they do 3 flips and they need to land it, like, are they landing on crash mats? Are they getting caught? Like, I needed to understand all those kind of things as well. So I think that's a wonderful thing for people to kind of use experience and the patients that they get in front of them to continue to learn and continue to get an understanding about that exercise or sport or activity that people are going back to. You can either brace it. If you don't feel confident, you refer it on.
Mm. Yeah. You've got, go for it.
I agree. Like, I'm still, because I'm 15 years out, I'm still learning. I'm still discovering things that I thought I had nailed. Like, the amount of time I'm still making errors, like in my clinical practice. There are days where I think, gosh, like I did that same treatment, I gave that same loading, I did that same exercise, that same program, to this particular person three months ago, and it's played well. But now I'm faced with the same scenario and it's not working. So, like you're just constantly reflecting, and certainly for any new grad, students or new grads that are listening to this, you certainly don't have it all figured out. And you probably won't even have it all figured out till late in your career. and some may not even still have it mastered by then, like the whole, like it's just a constant learning curve, and things change constantly.
Yet you can still offer people a high value of care. So how do you do that when you don't know something? I think Randall's already mentioned this. If he has someone referred to him with a wrist condition he's not confident with, he'll know 4 or 5 people who are good with wrists in the local area. So there's a networking thing there, but there's also an honesty, integrity thing that has to go on, where you say, I'm not sure, I want the best result for you. This isn't about me. This is about you and your wrist.
Absolutely. And the number of times, I'm similar to Randall, like I occasionally get a hand or a wrist or a thumb that lands on my list because it's an urgent appointment, and like they just needed to be seen. They almost just need to be triaged. And so, physio skill set that I've got, I can sort of probably differentiate between the ones that need urgent X-ray and those that, can probably be taped up and reassured and just given some early acute injury advice, which is still high quality education and information, and then referred on to the people who can help. That's to me, that's giving first class care, and there's been still a number of people that still I do that for.
What about if we talk about exercise within the context of rehab, when someone's coming in with a pathology, and if we position ourselves as experts in exercising when there's known pathologies, as we were talking about before, versus all the way at the other end of the continuum, coaching. So another form of using exercise for performance or for health, for example. Do we sometimes over-medicalise exercise, or maybe conflate the prescription of exercise with the treatment when the person has to be exercising to be a healthy human being anyway? And is there a risk there of us over-medicalising prescribing versus coaching? What do you reckon, Randall?
Yeah, I think it's a good point. I do feel that at the start, and if someone is coming in, Mick and I, obviously our specialties in ACLs and knees, so let's kind of use that as the example. When somebody comes in, post ACL reconstruction, you do need to medicalise the exercise, because you're trying to regain range of motion. You're trying to make sure that, your fusion stays under control. You're trying to get your distal quads to kind of fire up. And then as you progress through, you want to make sure that you're not going to create an inflammatory storm in the anterior knee. And so it needs to be very prescriptive, and it does need to be medicalised at that point. And I don't think, physio's any different to medicine in some ways, that, it's dose and dosage and how many times a week you're going to do it and that kind of thing. However, I think that, one of the roles I think that the physiotherapists need to take very seriously is again, what I spoke about before. And that's getting people back to lifelong healthy habits. And in that, if you then prescribe exercise like it's a medication, a lot of people just don't feel that they want to do that. Most people want to exercise because it makes them feel good, because it makes them look good, because it's social, because they know that there's health benefits there and they want to do things for long term. And I think that's where practitioners need to transcend from taking a medical approach to being a little bit more of a coach at that point, understanding what they want to get back to, and also orchestrating an environment that they can kind of get back to something that they enjoy as well. And in ACLs, we usually integrate that as part of the management anyway, because a lot of particularly athletes who are in team sports feel very isolated after a month or two. They're not playing netball, they're not playing football, they're kind of, in the rehab room, usually just with one other physio. And once you can start to integrate them into team bonding activities and make it social and all the reasons they did sport for in the first place, I think that that's crucial to kind of, we try and bake that in as early as possible and treat them as a human and not just a knee.
Yeah, that person-centered care. Mick, you've done lots of following people through from the time of injury all the way through to return to sport and beyond.
Yeah.
What do you think?
Yeah. I think I agree, 100% agree with Randall about the early days. We just got to probably be a bit more careful with what we do. In saying that too, there are lots of opportunities where the person can exercise safely and sensibly. And, the amount of joy I see on people's faces when we say, okay, you can get on an exercise bike now. And, they didn't believe that they could, or when their wounds are all healed up, and they're not going to be at risk of an infection. It's like, yeah, you can get into the pool now and do some water-based exercise. They're just like, oh my God, like it's just a game changer. So just to open up those doors rather than sort of being constantly saying no and closing doors to opportunity to exercise, because it's just not about the knee, for example, like this. It's also the physical and mental health in a wider context, and the mental health changes and the positivity that comes about by saying yes, you can get on an exercise bike now. Yes, you can go outside for a swim and get things moving if it's safe to do so. I really love that part of my job, but I also really like having that kind of later stage discussion too, because by the time someone's reached 12 months post-op ACL and they've sort of been in rehab, so to speak, for 12 months, the last thing, like they're just so done with the term rehab. They're done with, going to the gym and doing squats and lunges and that kind of stuff. And so for us, we know that longevity beyond that first 12 months and that consistency in exercise can sort of help them so much more over the next 10, 15, 20 years when OA changes are going to be a real thing for an impaired quality of life for these particular people. So for me, it's switching gears with the conversation and saying, okay, well, you've done with rehab, so to speak, if I think they're ready. But now we're going to sort of change your mindset about continuing to keep this rhythm going. You've been exercising for 12 months. now we're going to be exercising for the greater good of you, not just your knee anymore. So you trying to continue the walking program you're on, or trying to continue the bike riding or swimming program, this is going to benefit you in the greater sense of you than just your knee. And obviously talk about, the World Health Organizations and, the recommended guidelines for moderate intensity exercise is a big sort of conversation I have. We're looking to hit 150 to 180 minutes of moderate exercise per week, 2 resistance training sessions. And if we tick these things off, we're reducing our risk of all these lifestyle related illnesses, cardiovascular disease, diabetes, blah, 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 blah. So it's taking that general wider health lens when we're reaching the end stage of rehab with my patients as well.
That's so important for our grads and students and anyone else listening to hear. It's such a good answer to that question. The original question was, is there a risk of over-medicalising exercise? So here you're describing the pathway of when we really do need some medicalisation and some safety constraints put around what you're doing for many reasons, through to the point where the person, what they really need is individualized, person-centered care. They really need coaching and individual lifestyle modifications, and need to get back to their goals, actually achieve their goals. So it's such a good description of the person from the point of injury all the way through to a return to play or return to life.
Yeah. And I think like for new grads and students, it's making sure you have that conversation about someone, because every person sitting in front of you is going to have a different goal, a different dream, a different, want and desire to do exercise or movement. For some person, it might be going dancing socially. Someone in their 40s or 50s, that's their exercise. Exercise doesn't have to be sitting on a treadmill or standing on a treadmill or sitting on an exercise bike and, doing a classic 3 days a week gym program. It's making sure you ask the person, what do they love doing? Because that's probably the best indicator and the best thing for this particular person. And every person's different. Everyone's going to have different things. I think the hardest challenge is for someone who's just not at all motivated, not motivated at all to exercise and move. They're probably the biggest sort of hurdles we'll face as clinicians, is to try and encourage people to move who are just naturally a sedentary being.
What are some strategies that you both have for people who are under-engaged or disinterested in that approach to their health? Randall, you must have a few strategies for getting to know the person and finding out what they tick, what makes them tick rather.
Absolutely. You've got to dig down and work out what the goals are. And usually if you dig down further enough, you'll work out that, and if they're seeing you, we're physical therapists, we're physiotherapists. They're there to help. We're there to help them move better. So it might be a conversation not necessarily around sport or exercise. Would you like to walk for 60 minutes 3 times a week, or would you like to, go to the gym and then do a 100-kilo squat? Like, people go no, but if let's say they're just 60-year-old, 65-year-old people who haven't exercised much and they're just starting to get grandkids, you'll say, do you want to pick your grandkids up? Do you want to kick the soccer ball around with them? Do you want to be able to kind of go away with them up to Queensland and run with them on the beach and swim? The answer is going to be yes, and it's like, okay, if that's what you want to do, then you've got to do A, B, C, D, and E, and I will work with you individually to get basically as best bang for buck out of it as you can. But you've got to agree me, you just can't come in here for passive therapies and, your knee or your back's going to get better. You need to do your homework. And that's the skill, I think, in the art of being a good practitioner, is that you got to be able to sell, your program and your exercise to ensure that you get really good compliance.
And there are health professionals who will offer only passive therapies. There are alternatives, but you have that little window of time where perhaps you could sell and you could really change that person's life by getting them onto the right track. This is really good because we've had a chance to explore how you, both of you, with your wealth of experience clinically, how you apply exercise and some of these more challenging clinical cases. So it's a good segue into what you're doing with Learn.Physio. So you mentioned before, Randall, what you're trying to do with the podcast is have a little bit more of your information just in the public side and facing out. You've got obviously some pay-per-view content that I look at myself. I'm sure a lot of other people do. This is not an ad. Not that I'm aware of. They're not paying me anything for this. It's just a really useful resource, and my colleagues who are putting it together as a fellow educator, I'm interested in it. So tell us a bit about, so we know what Learn.Physio is. People can look that up. They can see what you're doing there with the platform. I thought we could share something that you've learned from Learn.Physio. So you've interviewed surgeons, physiotherapists, doctors, many people who are experts in their field. What are some of the most interesting snippets of knowledge that you've learned that you didn't know beforehand? Who wants to start? Obviously, people can find these on your platform if they want to follow up.
Maybe I'll start with, because I think I'll offer more of a general comment than maybe specifically what I've learned about, management of elbow problems or something, for instance. But I think that, and you're right. I mean, from last time that we spoke, we've got a lot more content on the site. Both Mick and I have kind of sat next to world-class experts, and not really interviewed them, but had a discussion about their area of expertise over a long time. A lot of these masterclasses go for 2 or 3 hours, and these presenters come in with extensive experience and extensive slides just ready to go. I think that one of the things I've learned is that they definitely understand the science and the research behind it. But when you get them live, particularly when they're doing anything to do with manual handling or patient contact, and we've had a number of people who have done live, essentially kind of live patient videos, for a better word, as part of their presentation, is you see how good they are at manual handling. You see how good they are at directing the patient to either get up, get down, move here, move there. 1 or 2 words can change their posture or their knee position or how they do their exercise incredibly. Those people skills on how they are kind but persuasive at the same time and getting the result there. It's a common thread amongst everyone who kind of comes in who's at that high level, is that they're technically very good, but they're also very good with their hands and their handling, and they're very good with their people skills as well. And I think that, for your younger crew of students and therapists who are out there, it's something that I think that they should pay a lot of attention to, because a lot of attention is given to the RCT or the systematic review that was kind of done on this area. But the execution and the implementation of that research and how it's done clinically and how you can motivate that person, similar to what we were speaking about just before, is something that's really been reinforced to me over the last few years by, being next to so many great people.
So those people skills, those interpersonal skills in combination with a very good technical skills and very good handling, for example.
And it's unique, Luke. It's you find that, that a lot of people can kind of do one or the other kind of well, but when you get the intersection of both, that's when you get people like Jill Cook and Julian Feller and Mick Hughes.
There's your intro.
Oh, very, very kind of you.
I just wanted to put you up there, Mick. So
that was good.
I would have thought about another half a dozen people other than me, but no, it's very kind. Look, I probably don't have too much more to add, because I 100% agree with my experience being on the other side of the couch to some unbelievable educators. I guess the career highlight for me was, sitting next to Jill Cook for 7 hours and just listening to her. Like we all know her, tremendous research with the tendon world, but her depth of knowledge in the tendon space outside of rehabilitation and knowing, these are the things that are going to help, but, just the level of knowledge that, she can talk about the finer points of the tendon cells and the tenocytes. She can talk about all the inflammatory markers. She can talk about the changes of hormones over the lifespan, and its effect on tendons. Like she's just got this such wonderful depth of knowledge, but also to such a wonderful application of that knowledge to a patient. And that's to me just sort of goes back to what Randall was saying. There's people, and we purposely pick these people because of their great mix of both being a clinician and being a strong, involved in academia more often than not. So they've got that nice balance of applying the research, but doing it in a very clinic friendly way, so that things are conveyed in context. Because we know how sometimes with research, research is often conducted in very sterile environments where it's very controlled. And the reality of life is that it's very chaotic for a lot of people. So being able to, take parts of the research and apply it to the person sitting in front of you, I think has been really good. And that's what our presenters have done really well, which I'm really proud of.
It's so good that you've got someone like Jill who has a lifetime of experience there and has all that wisdom. And if it wasn't 2025 and we've got easy access to online education, for example, well, a few people around her could learn that from her, but the whole world can now sit there in a masterclass and learn and have that wisdom passed on to them. So we live in really good times. You should always sit back and appreciate that. So 7 hours of recording, and then you edit it down to, say, 2 or 3 hour masterclass.
It was probably 6 hours. We didn't edit too much of it. It was a full it was a 4-day shoot. We broke down into so it was great. I just sat back and just soaked it all in. It was beautiful.
How much of that how long does it take you to integrate that into your practice? You might not be working exclusively with people with tendinopathy, but you learn so much, and then sometimes it takes a while to integrate that in, doesn't it?
I think so, and it certainly was a lot harder. I think it was a lot harder early on in my career. I remember going off to workshops and weekend Sports 1 courses, or going to attend I remember, dry needling course, or, a spinal course or whatever. And you spend these weekends in your first or two years, and because, you're kind of, I guess, your recognition systems and your own internal algorithms are sort of set in a particular way. And so when you're faced with a different way of looking at things and assessing things and doing things, going to work on the Monday and try to apply what you just learn on the weekend is actually, I found it really, really hard. And I think as I've got older, I've certainly got better at it, but I've also too been able to sort of see through the fluff and the smoke and the mirrors, and to sort of say, okay, I've had went to a conference and I've got this, and this, and I think these little golden nuggets of practical wisdom and information are going to be helpful. But I've also sat through, hours of other sort of things that are probably, it's nice to know, put into the back of my brain and sort of, use them whenever, but they're probably not going to be the thing that I use first thing Monday morning. And that filtering is certainly, for me, got better as I got older and more experienced.
If I can just extend on that, Luke, I think it's a really good point, because I think that, and this is in informal kind of conversations that I have with some of the Learn.Physio community who get our stuff. We've got a subscription service now where essentially you just pay a monthly or a yearly fee and you can get the whole library accessed any time. And what people say that they're doing is that they will watch, like Jill's class, for instance, or series, and you absorb it. But exactly like Mick says, a lot of it is at times can kind of go in one ear and out the other because you're not instantly applying it. But when you do have that difficult tendon that comes in 3 months later or 6 months later, and you've tried your normal course of practice and it hasn't really kind of got to it, that's the time to go back and watch some of that content again. And doesn't have to be Learn.Physio stuff. It can be any kind of resource that you have. And use that in a situational context to kind of say, all right, I've got Mary in front of me who's not going so well. She's 50 years old. She's perimenopausal. She's got Achilles that I just can't get over the top. What did Jill say about that again? What are the issues? What does she do at that point? And when you get those situations where you can combine the patient you've got in front of you with a little bit of background, but then it's reinforced at the right time, that can be extremely powerful and a great way to learn at that point. So I think that's one of the things that I think I've found really satisfying in Learn.Physio is that you've not only created a platform where you've got great people saying great stuff, but you've also got a medium that allows for people to go back to and continue to develop their understanding and their professionalism at the right times also.
You wouldn't advise someone to go and read a textbook cover to cover. You would use that as a resource. You look things up in that way.
Yeah.
But the masterclass has a chronological setup to it. You do tend to listen to it from one end to the other, maybe with a few pauses and coffee breaks in there. But then the advice there from Randall is to go back and bookmark things that are important, just like you would with a textbook. So this helps manage that information overload that we've talked about before on the podcast. There's so much good stuff out there, your platform and many others. And you could really spend all day not seeing a single patient and not making a sense and learning a lot. You wouldn't do that, of course, but what other ways can you manage that information overload? I guess what you touched on there was being strategic, and what you think, when I don't know something, I'm going to go back and have a look at it and look it up. What about when you're early on in your career and there's just so many choices? How early do you dive deep on things versus just letting it wash over you, do you think?
Yeah, it might be a good question to throw back at you, Lick, because you're involved in academia and teaching students and whatever, and I have read and understood that the attention span now of people who are reading and watching content has gone astronomically low compared to like 2010, for instance. And because there's been such a proliferation of short form content, so many people are just used to getting kind of information in 10, 15, 20-second bites, and then trying to remember all these little bits of micro content can be really kind of overwhelming. And that's, I suppose, that's what we do at Learn, is that we really try and encourage people to say, turn off your phone, sit down with a bag of popcorn and your iPad and write notes, for a 2 or 3 hour class, and absorb that longer form content. Because I think that it sinks in a lot better at that point. But I'm interested in your thoughts. I mean, you've been kind of teaching now for quite a while. Have you found that's true, that the students of 2025 have much less and you've got to teach differently to what you said, let's say 15 years ago?
Not really. It does sound like a really plausible hypothesis, and we're all distracted. We've all got the capacity to be very distracted and divided with our attention, with all the different opportunities to look at your phone and look up things that are high value and low value, etc. But if you think about the content that universities expect students to review, it's textbooks, long form content like yours in the form of lectures. And you need to still apply those high level learning skills to it. You need to be hyper organized. You need to have a plan. And I think there's a difference between how we behave and our capacity. So our capacity is certainly not that, we haven't reduced our attention spans as a species, but you can certainly fall into the trap of acting like you have, sit there looking at 7-second videos and losing an hour of your life. Our students have remarkable attention spans for listening to me for 50 minutes talk about the biomechanics of the knee, which will be happening to them next week. So, and the questions they ask are fantastic. I think we just need to push them because there's just so many potential distractions for them. I think what you said about putting your phone away and getting a bag of popcorn and investing time and letting the information, it's just going deep into the content. That's really important. There's so many excuses to stop and do other things. And it would be no different for someone putting 2 hours aside to do their Learn.Physio homework versus doing their entry to practice physio course homework. But what about you, Mick? You studied, it was 15 years ago now you did your physio, but what was it like then versus the dinosaur days? I finished in 2001. There were no phones with internet. Was it any different when you graduated for distractions and how you learned?
Yeah, there wasn't, because it was kind of 2010, I recall. Yeah. I didn't have a smartphone until I think I was 2012. So we're kind of at that cusp where, Facebook was around, but you kind of had to get onto it more often than not on a laptop, and Instagram was really in its infancy, and there was no, TikTok, Snapchats and whatnot. I did find I think distraction wise, there was not that same level of distraction as what there is now. From I guess from a, do you kind of, what you were asking before, do you kind of double down? Do you dive deeply into topics, or do you let it wash over you, kind of thing? Like I don't know. Like I think it sort of comes down to your own clinical practice. Like for me, I remember just routinely going home after every day at the clinic as a new grad and just diving into Bruckner and Kahn's clinical sports medicine every night, just because I felt like I was just swimming, and struggling to keep my head above water. Clinically, musculoskeletal surprisingly wasn't a strong area for me. My undergraduate, I guess, placement grades and my performance at undergraduate level, musculoskeletal was not fantastic, but I had a passion for it and I wanted to get better. I knew it was an area of weakness for me, so that kind of spurred that on. So I kind of did double down for me. Like it was like, okay, I could manage a patient. I could sort of bluff my way through a clinical scenario and manage them for 30, 40 minutes in the clinic. But when I went home that night, I was like, okay, did I get this right? Am I missing something? And I would constantly do that. That's probably how I spent my first year, going back and reliving the errors of the day.
So you both mentioned that need for conscientiousness and following up on information. So if we summarized all that, yes, there are times where you listen to everything from start to finish and let it wash over you. But to be successful, you really do need to be mindful and think about, what have I just learned? What are my knowledge gaps? Yep. And go back and read the textbook or watch that section of the masterclass again.
Yeah, I think it's just reflection, like anything. Like it may not happen on a daily basis. It might be a weekly or a monthly thing, but you I think at some point, be it early in your career, late in your career, you need to sort of think back, am I providing the best possible care to all my patients? Yes or no? And, like if you can hand on heart say, yes, I am, then, great, continue on as you are, you're doing a great job. But if you sort of feel like there are days where you're absolutely overwhelmed and you feel like you're floundering, then you need to be honest with yourself and honest with your patients, and you need to find ways to, improve that skill set. Now, whether or not that's reaching out to your clinic supervisor or a senior member of the physio team, or, enrolling yourself into an online course or going off to see a workshop, those things need to probably happen. But that time for reflection, I think, is really critical for a physiotherapist and their growth as a clinician.
Really important words, really helpful advice. Final thoughts while we wrap this one up. Randall, anything else you wanted to add?
If we're just talking about education and professional development, then the landscape has just changed so quickly, and I mean, we're part of that and we're part of the problem in some ways, because, we're things have moved online. And we do that, we feel like we do that well. We feel like we're adding value to practitioners' lives and their professionalism. But there is a big but. And the but is that we're still a people and a hands-on profession. And I think particularly with kind of like the acceleration of AI over the next, it's already here, but over the next few years, the way you are and the way you interact as a human with another human is going to be paramount. So I'd really encourage, for younger practitioners, don't rely on just platforms like ours to kind of get your education there. Make sure that you're doing the physical stuff as well. And that can be in your clinic or your practice or your hospital or whatever setting you're in. Watch people who have been there and done it and work with them how they do things physically. And the other thing I think is that there are still live and in-person events, whether it's conferences or workshops or courses, and to being able to kind of get your hands on other people and being critically assessed with your hands-on skills and the way you interact with people, I still think is fundamental to what we do as a profession. So that would be my final comment.
It goes beyond the manual handling debate. You use your hands when you're helping someone off the floor after they've done an exercise. You're using the physical skills that you mentioned go beyond using your hands for manual therapies. Yeah.
Gait retraining, helping someone with a squat, you want to kind of get someone doing a step up really well. Like all these things, if you put your hands and you watch the experts kind of do it in the right way, you can you can learn an enormous amount in 2 seconds. You don't tend to get that online as much.
Even though you guys have a high def filming happening in a really nice studio, multiple angles, it's being there with a person, learning from them. That's important. I like what before you said 1 or 2 words of persuasion or cueing, for example, and that person would move differently. So there's wisdom in that, distilling your complex sentence down to 1 or 2 words. And you learn that off other people, for example, those in your master classes. So there's some great final words. Mick, anything else to add while we wrap this up? In general, about exercise or anything we've talked about?
It's been a wonderful chat. No, I've probably got nothing insightful more to add. I think I'd just be filling out the last 5 minutes of absolute fluff, mate. But no, I appreciate the opportunity to come and talk shop with you, Luke. It's been a pleasure to have you as part of our educators and the opportunity to sort of talk more about exercise and Learn.Physio and education, and give Randall and I an opportunity to give our 2 cents worth has been great. So I appreciate the invitation to come and talk.
Yeah, hopefully introduce you to, and I assume a lot of the audience of Physio Foundations would know about you already, but introduce your new podcast, Exercise Matters, which they may know about already as well. Maybe they could be that 152nd subscriber to the
That'd be nice.
Spotify as well. So, by the way, if you're listening to these and you haven't subscribed, doing that really helps boost our content in the algorithm. So, sharing it, subscribing it, that's what you're meant to do at the end of these, isn't it, guys? The call to action. But personally, though, it's the emails and when someone sends an email, or a student even in our course says, hey, I've been listening to this. This was helpful. Give me more of that content. That's really helpful as well. I'm certainly not doing this. You guys have a commercial platform in Physio Foundations. It's just a part of my academic job. And my only goal is to give you content that you find helpful and focus on things that maybe I wanted to know when I was a young new grad as well. So hopefully this conversation is as helpful to you guys as it's been to me. Get on there and have a look at Randall and Mick's content online, Exercise Matters podcast. Give them a subscription, give them a subscribe or a follow online. And hopefully to see you guys again soon for another episode. But best of luck with the podcast.
Thanks very much, Luke. It's been great.
Thanks, Luke.
Excellent. So thanks everyone for joining us again. Like, share, subscribe, do all of that stuff. You can connect with Susanna and I at Peryton Physio. And until next time, this is Mick, Randall and Luke wishing you all the best with your studying, professional development and lifelong learning.